I'm Paul Guerra, Chief Executive of the Victorian Chamber of Commerce, and together with James Pearson, the CEO of the Australian Chamber of Commerce and Industry, and the Victorian Chamber of Commerce and Industry's President, Karen Sobels, my pleasure to welcome you today. It's exactly 1 week after the federal budget was handed down, and hopefully less than a week before us Victorians ease out of the next step of Covid-19 restrictions. Those 2 point-in-time bookends should give you some idea of how fortunate we are to be welcoming our Federal Health Minister with us today. What a year to be Health Minister, even for someone who is known as one of the hardest workers in Australian politics. And with that, can I hand to ACCI's CEO, James Pearson, to introduce the Minister.
Thank you, Paul and Karen, and it's great to see you, Minister. I'll be brief. It's great to see, excuse me, hundreds and hundreds of ACCI and Victorian Chamber members joining this call. Greg, we know how busy you are. We also know how much you value the insights that you get from business and your appreciation, as with your colleagues, Josh Frydenberg, the Prime Minister, Scott Morrison and others, the central importance of a business-led recovery. But in Victoria, we're not at that stage yet. And I know that you appreciate the hardship in the lives and livelihoods that are being affected here. And so welcome, Greg. We're very keen to hear what you have to say. And again, we appreciate your readiness to engage with the Victorian and the national business community.
Look, thanks very much to James and to Paul and to everybody. I understand what a difficult year this has been. Firstly, in terms of health. Secondly, in terms of mental health. Thirdly, in terms of business and all of the contributions that people have made. So let me run through two big things: what we're doing with COVID and where we're at as a country. And then secondly, what the federal budget means in terms of health and going forwards. In terms of COVID, as I said to the health stakeholders at my speech last week, it's in a way impossible that we have achieved what we have achieved as a nation. When we looked at where we were with projections of potentially 150,000 lives lost in March, best case scenarios of 15,000. Although there have been real tragedies, immense hardship, this was a counterfactual which the Medical Journal of Australia said would have seen 16,000 more lives lost and 16,000 lives therefore saved if we had achieved the UK outcome. And so the difference between the policy measures in the UK and Australia is 16,000 lives preserved. And it's important to remember, of course, the UK has taken massive, extraordinary steps, including national lockdowns and a national GDP loss of 20%. But it's all about what you do and when you do it. So firstly, thank you, acknowledging that hardship, particularly in my home state of Victoria. So we set out to do four things. Firstly, what we did was on the containment side, put in place the border restrictions. And those international border restrictions have so far prevented about 2,500 known positive cases that have been detected in hotel quarantine or shipboard from entering Australia. And we've seen what, one breach in Victoria has done. Imagine that to the power of 2,500. Secondly, the testing regime. And right through February and March, we were focusing 6 hours a day on testing, PPE and ventilator acquisition. And very significantly, what we were able to do was get ahead of almost every other country in all of those three areas of potential shortage. And the testing has meant that we've had, according to the London School of Hygiene and Tropical Medicine, one of the broadest, if not the broadest and most accurate testing regimes in the world. And that's allowed us to trace. And we're now at over 8 million tests. We set up a whole new national system literally overnight and worked with state and, very importantly, with private providers. The tracing system, 7 out of 8 states, has been extraordinary. Obviously, Victoria had its challenges. New South Wales was the gold standard, but that tracing has meant when you get good testing, you can trace those cases down. So we've provided 400 ADF to Victoria for tracing. We're still encouraging them to adopt the New South Wales elements of localised hubs of automated system, and then the turnaround times and the triple ring, as they call it, of contacts. We're working on that front with them. They've made significant progress. There's more to do. I've said that publicly. I'll continue to say that publicly. And then the distancing, all up Australians have been magnificent. I heard the discussion about the difference between Perth and Canberra, and that's reflective of everything we've heard. I'm in Canberra now. People are respectful, but it's different from Melbourne, which is a universe away at the moment, having just come from Victoria a few weeks ago and then quarantined up here. So that distancing is, of course, the last resort. It's what you do as an emergency measure. It's what you do to stabilise, but not to manage. And so with the Prime Minister and the Treasurer, the three of us have set out very clear statements to Victoria on that. And we'll continue to make the case that testing, tracing, isolation and New South Wales level restrictions are the appropriate way forward now that Victoria has comparable numbers to New South Wales and significantly below where New South Wales was for 24 days with infinitely lower restrictions across the latter half of July and the first half of August. So, all up, that's meant that we now have a situation where you have the US has had 1,700% per capita loss of life compared with Australia, a greater loss of life than Australia. The UK is 1,800% and France is 1,900%. And so just an extraordinary difference in highly sophisticated countries. And then in much of the developing world, very significant numbers, but numbers that we believe simply because of the limits of the public health and testing systems are not reflective of the full scope and spread. They're all done with the best will in the world. It's just the capacities of being a developing health system. So against that background, all up, we've invested about $16.5 billion, and our outcome in terms of the top quadrant of countries with a low economic impact compared with the rest of the OECD, countries with a low death rate compared with the rest of the OECD and the rest of the world, or economies. There's really Australia, South Korea, Norway, and Taiwan that we put in that. New Zealand's done really well, incredibly well on the health front. They had a 12% hit to GDP following their measures. So in that combination of countries that have achieved on both fronts, we're right there. The economic side, going forwards, the Treasurer, the Prime Minister laid out the budget last week. You understand the investment mechanisms which are absolutely critical, whether it's in terms of the tax cuts that have already passed to spur individual actions and investment, the loss carryback, which is a novel approach to recognise the hardship that existing businesses have suffered and which won't easily be claimed from the tax system unless they can go back on their previous profits rather than their future profits. And then the massive instant asset write-off, an over $20 billion investment, all of which are designed to work with different parts of the economy to drive investment and drive jobs being the principal and fundamental part of the budget. So then within health, where we fit in is that this year, what you see is there's a $32 billion increase over the 4-year forward estimates in our health spend. And that works across the 4 fronts that we have in health of primary care hospitals, mental health and preventive health, and medical research. In terms of primary care, there's a $6 billion increase in Medicare, and it's gone from $19 billion to $29 billion this year to $32 billion at the end of the forward estimates, $19 billion being where it was before we came in. The biggest reform, though, is telehealth. And that was actually born of COVID. And we had a 10-year migratory plan. We delivered it, and it taught us all a lesson in 10 hectic, pressured days at the end of March to protect the doctors, to protect the nurses, to protect the patients. And it's now been enshrined with over 34 million telehealth consultations, a budget which lays out the pathway for it to become permanent, but permanent on a sustainable basis. And we're now striking the agreements with the AMA and the College of GPs and the other arms of the medical sector. But it's arguably the largest change in the delivery of health services since Medicare, and it was delivered a decade ahead of schedule because of the need to respond to COVID, but it taught us something about the speed with which we can make massive transformation. The second great primary care initiative is a national Medicare PBS funding guarantee. And that means that whereas we'd already guaranteed we'd list new medicines, now there doesn't have to be an offset. There's still the rigour of assessment, but the offsets for the last 20 years had come from within the health portfolio, which had led to some of the great challenges within the health portfolio. So that's been changed, and that's a multi-billion-dollar additional investment in new medicines, which has given incredible certainty to the pharmaceutical sector. Then what we have going forwards over the course of the coming 5 years is a new hospitals agreement. So this is the second of our health pillars: Medicare and PBS, hospitals. It's a $133 billion agreement and a $33 billion increase over 5 years. Most importantly, though, there's dramatic reform in terms of funding high-cost therapies with the states. For example, Hemlibra, which would otherwise cost $675,000 for a once-in-a-lifetime treatment for haemophilia, which is effectively a cure. And nobody could afford it, but they'll be able to get that treatment free of charge now. And then the move to hospital in the home for mental health and for orthopedics. And that's backed up with the second wave of our private health insurance reforms, where there's mental health and orthopedic hospital in the home, parallel in the public system. There's the ability to keep young people on the family policy until they turn 31. And then there's much better transparency of out-of-pocket fees. So all of those things are coming together. That then leads to mental health, where this has been an agonising year for mental health. And tomorrow we're releasing figures which show that Medicare mental health provision for Victoria is up a third for this year as opposed to last year. Beyond Blue services in Victoria are per capita up 77% in Victoria compared with other states right now. And so Victoria is suffering, and that's one of the reasons why we are deeply concerned, as is the World Health Organization, about lockdowns becoming the norm, apart from civil liberties, apart from business, apart from economic outcomes and jobs outcomes. They have a profound, understandable impact on mental health. And so we'll be saying some things on that tomorrow. And then, but in mental health, in particular, we've doubled the number of psychological services available under what's known as the Better Access Medicare scheme. And that's backed with 64 million of additional suicide prevention and trauma funding. And then on preventive health, we've done something really nice. And that is, for the first time ever, long overdue, half a century overdue, we have compensated the thalidomide victims. And that's to deal with the past wrong, but also to deal with a lifetime of physical pain that they still have to face in their years to come over, the next 2 or 3 decades. And then that leads me to medical research, where there's quite profound reform that's been announced. We are shortening the time for approvals, again through the TGA, shortening the time for medical cannabis approvals. We are investing $6.6 billion in medical research, and in particular opening new rounds for frontier science, for primary care, and for children's cancers. But we have a 10-year funding plan of over $5 billion alone in the Medical Research Future Fund. So there's that long-term certainty which will attract business to invest in Australia as part of a $600 million clinical trial, but a $5 billion investment under the Medical Research Future Fund, which itself has now reached its maturity and been capitalised in perpetuity at over $20 billion. So all of that is the health story. It's about patients, it's about system sustainability, but it's also about using that to drive jobs and investment in Australia. Over to you, James and Paul. Happy to take any and all questions, and let's go till 4 if that works.
That'll be fabulous, Minister. I'll take you up on that. So just to set everyone's expectation, you're here till 4. I'm going to bounce you through a few questions. Let's focus a couple on Victoria, which I know is close to your heart. Then I'd like to talk a little bit about vaccines. And then let's talk about the wider health from there. So let's start with Victoria. No one's happy with where it's at. You know, we hear the commentary out of the federal government in support of what Victoria needs to do. We hear a lot about the third wave. You've already touched on how well Australia as a whole has done, even with the Victoria second wave here. The risk of a third wave seems to be what's holding us back. Are you able to shed some light a bit more around the risk in relation to a third wave and what the model is showing around that?
Sure. So the first thing is that, the University of Melbourne, which was cited as the source and the reason and the justification for the timetable out, we accepted that once contact tracing had collapsed in Victoria compared with the other states, and the numbers were, in the vicinity of 700, that they had to do the stage 3 and stage 4. We accepted that. Reluctantly, regrettably, we recognised it was regrettably necessary. And so we didn't stand in the way. But we took a very different view to the pathway out. And when the University of Melbourne modellers said, our model doesn't justify the 5 case and 0 case thresholds because they're not easily achievable. They're not, and nor are they necessary. Then with that, we said, well, the Commonwealth definition is 10, a rolling average of 10 cases. Now, Victoria is sitting at or about that. And so that's been the Commonwealth definition. New South Wales was out of the Victorian restrictions at higher numbers than Victoria is at now.
Yep.
They moved. And so we have, from our Commonwealth Chief Medical Officer, a definition of greater than 10 cases being a hotspot as a rolling average. And our view is that if Victoria is below 10 cases, then it should be able to liberalise towards the New South Wales level of restrictions. And they're moving it in a graduated step pattern. Many people would want them to go faster. We think they've gone at an appropriate pace, but they've shown how the primary mechanism of defence should be testing and tracing and localised isolation, rings of containment, as opposed to a blanket lockdown because of the mental health, because of the economic, because of the social consequences, precisely as the World Health Organization has said. And we think that Victoria can manage. They actually need more confidence in their tracing system. It's not as good as New South Wales yet, but it's significantly better than it was.
So let's pick that up. And I've spoken to the Vice-Chancellor of Melbourne University, Duncan Maskell, who explains to me there's a difference between modelling done from the University of Melbourne and modelling done by a researcher at Melbourne University. There is deviation in terms of what perhaps different modellers have in mind, which are partly what you're addressing there as well. The contact tracing system, we believe in business. It is the single biggest defence that we've got against COVID. You've touched on it there. What else does Victoria need to do to get that right?
So 3 elements to contact tracing in Victoria to match the gold standard of New South Wales. One is to adopt that localised hub model within the community. That's under development. It's not there yet.
So is that a function of the New South Wales health system, or is
Correct.
it something that was able to be stood up along the way?
No, New South Wales had a more distributed public health system based on localised units. but nevertheless, they were able to build on that very, very quickly.
Yep.
Secondly, there's a model where it's digitised. The Victorian public health contact tracing system was a paper-based system. When Defence arrived, there were 1,000 untraced cases.
Yeah.
And that was why there was this spread. So we pumped personnel in. I think that it's been well traversed publicly that we have done our best to provide Defence personnel to Victoria for a variety of tasks. When they took it up, then Defence started to make a difference. Commodore Mark Hill, so a one-star, played a very important role, but he had a whole team of 400 under him. They provided additional personnel to Victoria. Now that it's down in, the rolling 14-day average of 10 cases a day,
yep.
So like bang on 10, they ought to be able to trace every case, not just to one ring away from the person. So the initial person, a second level, and then a third level. They should be able to get to that third level, and that's the other part of what New South Wales does. So localised, digitised, 3 rings of containment.
Yeah. The third level, I suspect Victoria is building towards, but in terms of updates from Victoria, how close do the health departments work? I mean, is information being shared with you at a federal level to give you the confidence that Victoria is taking the right steps?
Yeah, well, what's known as the AHPPC, or the Panel of Chief Medical Officers and Chief Health Officers, meets almost every day. And sometimes they'll meet informally as Chief Health Officers. Sometimes they'll meet informal council as the AHPPC or Health Protection Principal Committee, but think of it as the Medical Expert Panel.
Yeah.
And that's been going on since February.
Yeah.
And so that exchange is very strong. We had to work with them on the data provision. It was something that Brendan Murphy spent an immense amount of time on. It's something that Commodore Hill has focused on, Paul Kelly, the Acting Chief Medical Officer. All of those things were very, very, very much a Commonwealth focus to assist them with those data standards and the reporting around them. But if you hear the New South Wales, they'll be able to tell you every case, every place. They'll announce it. They'll encourage people to be tested and to isolate. If they've been at the Crossways Hotel, if they've been at the Thai Rock restaurant, very, very clear public advice, and then they follow through every case.
Let's hope we get there and get there soon. I do understand it's building. I know I've been invited to a briefing on contact tracing on this Friday, so I'll be able to update members after that. So I want to move on now to vaccines. Where are we in terms of, are we optimistic? And if so, what sort of timeline are we expecting? And expand beyond it if you could, the likelihood of how long it will keep you vaccinated for.
So the PM was actually yesterday at the University of Queensland. He and I were talking about his journey yesterday, where he met with the researchers. Bottom line is we are cautiously optimistic about a vaccine. I've been very cautious for a very long while. Some, in other countries, people have been more forward-leaning, but until we saw data that the vaccine candidates from around the world that were credible were firstly safe, and secondly beginning to produce T-cell and antibody responses or antibody, then we weren't willing to start to say this is a viable proposition. Now we're beginning to see this across a range of vaccines. The two that we have moved on first, the Oxford AstraZeneca vaccine, where we've secured 33.8 million units, and the University of Queensland CSL molecular clamp. Both of those are seeing good early data. The Oxford vaccine's at a third, phase 3. University of Queensland's at phase 1, but we'll catch up reasonably quickly. And so between those, we are confident vaccines will still have an up and down journey.
Yep.
You know, when you have a population of 50,000, all the adverse events are reviewed, and they're often the case of a pause, and they may be vaccine related or completely unrelated. But if there's the possibility, then they're focused on. But then there's a range of other vaccines obviously being developed around the world. So you have your traditional protein vaccines, you've got the molecular clamp, you've got breakthrough new mRNA vaccines, but with significant cold storage, logistics change and challenges. But bottom line is we've secured two. We have bought into what's called the COVAX facility, which basically gives us access to 25 million units of vaccine, no matter which of dozens and dozens of vaccines come up. So it's taking options and a right to participate and a right to access in any of dozens of vaccines. And so we have that insurance, and then we may strike, we're looking at other candidates to indicate whether or not it's in our interest to have a direct purchasing agreement. We're thinking first half of 2021 for first delivery. We still have advice that the first quarter of 2021 is more likely than not. And then to be rolled out during the course of the year. The estimates in the budget are actually very conservative. So
Okay.
I think we will do better, but we put in a conservative estimate.
So that's good news. So not only have you secured it, you've secured it in a way that when it's ready, it'll be delivered in Q1 next year. So,
well, not all at once. It will be literally over 9 months.
Yeah.
Based on availability and distribution. But we've got a national plan for rollout and distribution.
So we heard President Trump talk about the fact that he's immune forever. And he can't give it to anyone either. I hope he's right. Someone that's had COVID, I absolutely hope he's right. But what's the testing showing in terms of a vaccine? Is it going to have a year before you need an immune booster? Is it 6 months? What's it looking like?
So the actual vaccine will be most likely a 2-shot vaccine. Yep. That's the early indication. So about 30 days between first shot and second shot. Then the rest is not known yet. That's an honest answer.
Yep.
I was probing this question yesterday with our medical expert panel leaders and also with the companies. I've spoken with the chief researchers for both the Oxford and for the University of Queensland vaccines. Their view is it's unlikely to be lifetime. It's likely to be longer than a year, so not as frequent as flu. Their best guess at this stage is some years, it might be 5 years. That's not a hard figure, but if you look at their probability distribution, they'd have their mid-range scenario at being about a 5-year window. No guarantee at this stage.
Yep.
More information needed, more data, but that's the best estimate from the best scientists.
It's good. I've got 2 more before we go to wrap up. The first is alternate treatments, and we have one of our Melbourne Chamber members here, Griffolds, who's a world leader in plasma treatment.
Oh yeah.
What can you, and I'd love to introduce you at some point. They're doing some really neat treatment with plasma. What can you tell us about that treatment in terms of how it does positively impact COVID?
Yeah, so there's a series of different therapeutics and treatments that are available. So these are when they're different to a vaccine. They're not a prevention, but they reduce the likelihood or the impact. And probably the best known is remdesivir. We were able to maintain a supply for Australia. That's for the critically ill patients. And we were able to maintain that supply when there was a global shortage. We had a direct relationship with both the company and the US government. And so we were lucky enough to work very, very hard and get global priority. Secondly, dexamethasone, which is the opposite, a steroidal compound which is readily available, that has an impact. Then there are other therapeutics such as plasma, which have the capacity, not proven yet, but have the capacity to reduce the impact and potentially to provide greater barriers, not vaccine-like barriers, but preventive capabilities or reductions in the impact or the likelihood of contracting. Plasma is one of those. We've provided funds to support plasma research, and there's a JV between Australia and Japan on that front, and that's being used to look at the capacity of plasma to provide a therapeutic outcome. I haven't got any updated research on that, but it was deemed to be sufficiently prospective to put in an Australian investment.
Great. I might update your office separately to that and what Grifols are doing as well. It might be interest next time you're down in Melbourne as well.
Sure.
Final one from me before we wrap. And Sue Williams from Cabrini, who we work closely with, and I know you know, talks to us about the cancer treatments being down about 30% year on year in Victoria. Our concern, obviously, and I'm sure it's not lost on you, is will this mount to higher health costs at some point in the future, given people aren't being checked, not just for cancer, but for other illnesses as well?
Yeah, so we've been very focused on encouraging people to continue with their regular screening and treatments. But it is something that's understandable, and it was we identified it early. I remember in late March with Michael Kidd, and Nick Coatsworth doing press conferences where we were urging the public to continue to do that. I'll have more to say in the next 48 hours on this. So we are focused at this stage. We're hopeful that it can be caught up pretty quickly, and we have the 3 screening programs of breast cancer, bowel cancer, cervical cancer. But we're really going to be pushing for people over the coming weeks to continue and recommence. Victoria is the one where it's dropped.
Yep.
And at the same, so screening has dropped in Victoria, mental health presentations over telehealth, as well as face-to-face and acute presentations have grown. So that is a risk, and that's one of the significant risks of a prolonged lockdown. And so, it's played its part, but it's this idea of having a population confined to quarters indefinitely creates a very significant mental health impact, but it has a profound underlying long-term health impact, as you've set out. I'm happy to take 2 more questions, if that's all right.
Fabulous. I will absolutely take you up on that. Just your view in terms of some of the more practical side, masks ongoing in terms of not only Victoria, but across the country. And then probably a double question, which might lead into it, border openings. Particularly, Victoria, we actually don't have any borders closed, but we have other states not wanting us to come in. Where do we sit on both of those?
Yeah. So on masks play a role. We moved there, as the situation broke in Victoria. Once it moved into its second wave, and then New South Wales was at risk in mid-July and early August. So they are not, as the AHPPC and many have detected around the world, an immunity code. But what they do is reduce the risk of transmission, and that's there's a long medical history to indicate that. Now, they're not being used in sterile conditions. They're not being used in the way it's done in an operating theatre. They're being improperly worn. I didn't say that, when you have 5 million people masking up for the first time, as no one in Australia knows better than me, it can go badly. So I am the, enfant terrible par excellence on that front. But what we do know is that it's part of reducing the risk of transmission. And it has played an important role, and I have been a supporter and an early adopter, albeit imperfectly, and as my wife's video showed, there's a right way and a wrong way to do it.
And the borders?
Oh, borders.
Yep.
So borders, we haven't supported or advocated, and there hasn't been medical advice to support or advocate internal border closures other than for a ring of containment around Victoria. So we use a ring of containment model. And then once the Victorian numbers grew, we agreed with New South Wales and South Australia that it was appropriate for them to put in place restrictions. But to have restrictions between New South Wales and Queensland, between Queensland and other states, as we saw with the case of the young woman from the ACT who was denied the ability to go and see her father's funeral, or to attend her father's funeral, when the ACT had a better epidemiological history than Queensland, that was not a medically based decision. And they moved on that a week later. And essentially, Australia should be in a single travel bubble, but for Victoria. And the time will come reasonably soon where when the Victorian numbers are very low, then that will be appropriate. So we've supported the restrictions around Victoria, but we haven't supported any of the other border restrictions. And there is clearly, a situation where we are getting no more than, 6 or 7 cases around the country outside of Victoria. The epidemiological risk is very, very small.
Great. We'll take that as another optimistic viewpoint that we can all hold on to, that hopefully before Christmas they will be open. Minister, that's gone really quick and we appreciate it. I'm going to hand to our Victorian Chamber of Commerce and Industry President, Karen Sobles, for a vote of thanks.
Thanks, Paul, and thanks, Minister. And first of all, thanks for extending the time today. We really appreciate it. I think you can see by the number of questions and comments that have come in, and I think Paul's tried to cover some of them, that there's a huge engagement here. And of course, being in Victoria as a business owner and the President of the Chamber, we're very, very interested in getting this licked, particularly from a contact tracing perspective, because that is our way of going forward and becoming able to operate in a normal type fashion. And your information on that is very interesting, some of which was new to me. So I look forward to Paul's briefing on Friday with the Victorian Government as well. Your information on vaccines is very encouraging. We need great encouragement, but I was concerned with the budget that it might have been overly enthusiastic with some of those presumptions in the budget. So great to hear that really you're looking at a very positive outcome there. So that is just fantastic news for all of us, because I think certainly we've gone out publicly and said our response to the budget is, in the words of your wife, nailed it. The response from a business perspective is just terrific, because what we need in Victoria, though, the best outcome we can have is to get back to business. It's not just taking handouts. We want to get back to working. We want to be giving out more jobs. We want to be helping the economy. It can't just be relying on the government. And contact tracing and vaccine are absolutely key to both of those. So thank you for that. And I want to thank you also for your, as a Victorian member of Cabinet, for your personal support of the state, and also from the Treasurer, Josh Frydenberg, to coming out and continually supporting and being very, very aware of where we're at here in Victoria. I know sometimes other states might lose focus on where we're at, but we are in a very different position, and I know you understand that very, very keenly. So thank you for your time today. We really appreciate it, and we appreciate all of your work that you're doing on our behalf as well. So thank you.
Thanks, Karen. And just to everybody, I want to thank you again for what you're doing around the country, but particularly in Victoria. And we're just intensely aware that there are some businesses that have no business at the moment. I think of the small travel agents that I met with from the Mornington Peninsula just over a week ago, where through no fault of their own, that business model has been dried up as a consequence of the movement restrictions. And so, we have plans on the borders, careful staged plans, which won't see quarantine lifted overnight, but will see low risk, high priority countries such as New Zealand progressively brought into the bubble, where some will not need any quarantine, some will need home quarantine, and then some will need full quarantine. But secondly, our job now is to make sure that in a COVID-safe way, Victoria matches the contact tracing of New South Wales, but also with numbers that are similar to New South Wales, matches what have been the New South Wales restrictions. Safe, but primarily open, rather than safe, rather than primarily closed.
We agree.
I think we can get there.
Indeed.
Fabulous. Thanks, Minister. And can I just say, You might remember we caught up for dinner in early June, and
Yes.
we reflected on how much the world had changed in Melbourne just then. Even being able to have dinner back then is blur from now. But you spoke about securing PPE and ventilators at a time of massive global competition. And I have to say publicly that we're really lucky to have had somebody as hardworking and as globally respected as yourself as our Federal Health Minister. And on behalf of all of us here at Victorian Chamber and the Australian Chamber, we're lucky to have you as a Health Minister, and we're sincerely thankful for the hard work that you've gone to. So it's not lost on us, and we certainly appreciate it.
Take care. We'll get there. We will. Get there.
So finally, thanks to Karen, James, and of course, a special thanks to Aki's Paul Nicolau, who we couldn't have done that without this today. Finally, before you go, with the grand final not far away, and I'm sure we'll be all watching with interest, together with Picture Partners, Becky will again be presenting our grand final lunch. It'll be different this year because it'll be online. A range of guests from Nathan Buckley, AFL CEO Gillum McLaughlin, Dennis Committee's dropping by, Mike Brady will be singing up there, Kazali, and even Eddie will be dropping in as well. All were hosted by Hamish McLaughlin and Daisy Pearce. Watch it from your home or your office. It'll kick off at 12:30 next Tuesday. Get your tickets online at www.victorianchamber.com.au. Got over 100 registered so far, so don't miss out. So finally then, from everybody at Becky and Aki, we look forward to seeing you at our next webinar. Have a great afternoon.